ladies and gentlemen, welcome to my Facebook Live. Thank you so much for joining me today. Today we are going to touch on a very important subject, definitely for women, but also for men, you know, if you have partners and so on. This is about female well-being. Okay, so we are going to touch on topics like female sexual health. We are going to talk about urinary incontinence, which affects a lot of women, and we'll talk a little bit about even cervical cancer, how we can prevent it, and how we can do vaccinations. Okay, again to remind all of you friends that we are open 10 to 6 p.m. on all weekdays, including Saturdays. That means Monday to Saturday, 10 o'clock to 6 o'clock. And if you guys at any time have any question at all, have anything to do with your health, your beauty, your well-being, your fitness, please feel free to contact us at this number. Okay, and myself or one of my reliable staff will be there to answer your queries. Okay, let us first talk about vaginal laxity. Why we talk about vaginal laxity? It's a very important topic that is very close to my heart. And why is it close to my heart? Because I'm a woman, of course, and also because I've been treating female issues for the last 35 years. For many of you who don't know, I did gynae work in a government hospital for 10 years. So we have seen a lot of female laxity issues during that time. At the time, our hands were tied because other than doing surgical correction or doing repair for a full prolapse of the uterus and the vagina, we did not have many other armaments. But for the last maybe around 18 years or so, I have been actively involved in treating vaginal laxity. Vaginal laxity is a very important and common condition, and it does not only affect older individuals. Many people think vaginal laxity and urinary incontinence. When we say urinary incontinence, means without your control, suddenly urine dribbles out. You know, that is urinary incontinence. When we say vaginal laxity, it actually means the vagina starts to feel loose, it has less sensation. You and your partner both will feel less during sexual intercourse. So it affects a lot the family unit in total, because once your sexual well-being is not good and then you are having issues because of that. Many women are shy to have sex because of this. Many male partners sometimes look for other partners because of vaginal laxity. So it affects in a social way. It is not just one person's problem. It affects a whole family unit and then even the society. Because a woman who's unhappy, she goes to the workforce and then she brings her unhappiness there, and then a lot of things will cascade from there. So these two topics is very important for us to deal with. And if any of you are having this vaginal laxity or urinary incontinence problem, it is very important for you to open up. It is not like those days where gynecologists were too busy to handle a lot of these questions. I've heard things like, I have been dealing with this for many years. If you look at this article, and this was on 29th of July, published 2013, okay, talking about vaginoplasty and even designer labial vaginoplasty. This was by Malay Mail. It was almost a viral article, I would say. So, and before that, I've done many press conferences, talked to many media about this. A lot of people started to approach me after these articles were published, or I did a talk on TV, on radio. A lot of people started to call. The phone didn't stop ringing, basically because many women told me that they never realized that there was help for them. They thought they just had to suffer with this problem and keep quiet about it, because they said when they spoke to some of their home doctors who helped them to deliver their children, they were like, you had 2 or 3 children, so it's expected, that kind of thing. But now things are a lot more advanced. So just in the field, starting from about 2009 or 2010, when Mona Lisa Touch was introduced by me to the Malaysian market, this was the first treatment method. It's a laser method to tighten the vagina, but so much of the treatment method was in doing multiple treatments. And at this moment, we know enough about these treatments to say that this works very well in the older individual when they have no hormones, their vagina has atrophied, or it is shrunk, or it has become so dry, or it's got certain skin conditions like lichen planus, we call it in medical terms. It's actually very itchy, plaque like things inside the vagina or just around the vagina area. So for this kind of things, the laser method is very, very useful. So I introduced this to the market first at that time, and after that we have come up with so many different modules. Of course, other than the surgical corrections where I use laser to open and stitch back everything, we also have like the VIVIV, which our slogan is so happy together. And why we say so happy together, because it not only helps to remove aging issues, but even in younger individuals, sometimes they have given birth to a vaginal delivery couple of times, or sometimes they had instrumental deliveries, we call it. They had a forceps applied to pull the baby out, or they had a vacuum delivery, or they had very, very long labor, where many times vaginal examinations was done during the delivery. So even after one child or two child, I've seen very young individuals suffer with this issue. So VIVIV helps not just to tighten, but it also increases the sensations. It also helps to achieve better orgasm, and it gives better satisfaction to both parties in the sexual side. So that's why the slogan is so happy together. But this VIVIV is a very unique monopolar radio frequency method. So to this tip then is attached, of course it's a consumable, that means we can't reuse it at all, is attached the handpiece, and with this we will treat in a 360 degree all the vaginal area. And then the latest tips also come with longer ends where we can go into the phonics. Let me show you the picture where I can tell you where the treatment is done. Okay, so say this is the vagina. Okay, this is the vagina, this is your uterus, this is your fallopian tube and your ovary. Okay, and this is the cervix. We will talk about what happens in the cervix with cervical cancers or cervical issues. There's other cellular changes that can cause chronic bleeding and all that also. But for treatments like Mona Lisa Touch, VIVIV, or even for Ultrafem, which has got not only the inside tightening, the Axillus Ultrafem 360 as we call it. Again, it's got the tip, we will attach it, and then this will go, the energy will go not just straight in, it goes in a 360 degree. So it's a very comfortable sensation for the woman being treated. And then we have another cosmetic arm for it, where we will lighten and tighten all the areas like your labia majora, your labia minora. Okay, those are all the other anatomical structures surrounding the vagina. So we have come leaps and bounds, come up to do many kinds of treatments. But why are we placing so much of importance on treating vaginal laxity? Because there's been consensus and studies that show that more women suffer from vaginal laxity and its associated problems compared to cervical cancer. I'm not saying cervical cancer should be ignored. It's a very important thing. In our centers, we always advise all our women, even if they come for just beauty needs on their skin. I always, being a gynecologist, I always advise my patients to try and do a yearly pap smear. We also do, yearly pap smear is one of the most preventive health thing that you can do. If any of you have not done a pap smear for more than 1 year and you had sex just once in your lifetime, you still need to do the pap smear yearly. Because there are many women who tell me like, yeah, I now don't have a partner, so I don't have to do pap smear. Not true, because once you have sexual intercourse, there's a lot of germs that is introduced, so that can start to cause some cellular changes, infections, etc., etc., all of which need to be treated. Of course, we also do regular HPV screening for those who want to do HPV screening. Let me explain again what is HPV. It's human papilloma virus, and there are some very bad strands of those human papilloma virus which cause cervical cancer. And cervical cancer is by far the most common cause of death in young women. Okay, of course, what causes higher risk to have cervical cancer? Of course, if you're very promiscuous, you have multiple sexual partners, and you had many children, and yeah, you're generally health-wise you're not good, then you may have a higher risk. But everyone should also be screened for HPV, and if you do not have any of the dangerous strains, of course, we have the vaccinations. Okay, it's just 2 vaccinations, just like COVID-19, just 2 times, first month and second month, and that's it, you're protected for life. So this is something we can't ignore. So let us talk about why the vaginal laxity problem is so important. Okay, first of all, the vagina needs to be basically within a certain extent. It needs to have extensibility. At the same time, it needs to be tight. How does the body achieve it? You have these folds in the vagina. They are called ruche. And when women do not have these folds in their vagina, that means the collagen inside is lost. So when the collagen is lost, the extensibility will be lost. So what is the downside of this? The vagina actually shortens. Okay, when the vagina shortens, your partner will be completely unhappy with it. Basically, you need to have extensibility. So treatments like what we talked about, the VV, the Ultrafilm, actually helps to make the ruche come back, because it's improving your collagen regeneration. And because these two are also radio frequency based, they work completely different than a laser. Because many times, because lasers are becoming very common now, many people have lasers, but lasers is useful, but for older individuals who have lost all their hormones, they cannot be treated with hormones for certain medical conditions, and then they have very dry vagina. So just to do the top layer, which is the mucosal layer here, laser is important, but laser cannot imitate what the VV or the Ultrafilm do, because that is the one that is going into the deeper parts, and it is, while cooling down the top, the mucosal part for safety, it's actually helping to build up the collagen layers. And then at the same time, the collagen layers has got a lot of glands which is secreting all the lubrication which is necessary to keep the pH of the vagina stable. Because if your pH is too high or too low, then you're going to get white discharges, you're going to get infections in the area. So you need to have the pH for health reasons, not just for sexual reasons. For good health, you need to keep the pH good, the lubrication good. So that lubrication can be re-established by doing treatments like Ultrafilm 360 or VV. And what's the difference between these two? VV will treat urinary incontinence, it will treat the whole vagina in that 360, because the vagina is like a pipe, right? It's a 360 angle organ, so we need to treat everywhere to get the maximum collagen plumping, and then the contraction, and then the ruche, and then you get better glandular stimulation, so the glands will start to secrete your lubrication. And what's the other extremely good thing that VV does that nothing else does, is that because it penetrates so deep, the energy, in one single time it can wake up all your nerve endings. So you're also going to feel more during sexual intercourse and be able to achieve orgasm, which nothing else can do. So VV is a single treatment, whereas when we talk about the Excelis 360 ultrafem. We do between 3 to 4 treatments in an average. But what's the advantage of this one? There is a cosmetic harm to it. So sometimes not just the internal tightening, people also want a bit of lightening of the skin around it. The labia majora and minora, they want it to be firm without wrinkles. So all of that treatment, even the clitoris area, all can be made better and collagen rich with the Ultrafem 360. I have more questions coming up. One of the questions I think is relevant. If people remove the uterus, do they still have to go for pap smear? Well, this is a very important question indeed, because if you removed your uterus through the vagina, okay, then it's not just your uterus that will be removed, okay, it will be this whole thing that will be removed, okay. So the uterus will be removed together with the cervix and the vagina, okay, all of it will be removed. So if this is removed, it's the whole of the uterus and cervix will be removed, your vagina will be there. So it's always a good idea. I will tell my patients, if they remove their uterus, at least 2 years once, they can come in to just do a smear to check on vaginal areas, because vaginal areas also can have cancers of the vagina. It's not unknown, not as common as cervical cancer, but it is not unknown, so we should be checking on it like 2 years once. And then the uterus was removed, and sometime together with the tubes and the ovaries removed, then your cervix most of the time is left there. Okay, so if your cervix is left there, just like any other woman, you will still need to do the pap smear on a yearly basis. And it's not only yearly basis. The yearly basis is not written in stone. Sometimes we notice some atypical cells, which is not cancer cells, but slightly different kind of cells, or we notice that there is some severe infections that need proper treatment. Then after doing the treatment for these conditions, we would suggest to the patient when they should come back. Maybe it can be 2 months, it can be 4 months, it can be 6 months. So you need to follow the advice of your doctor to go back and repeat the pap smear as necessary. But if nothing abnormal was noticed, once a year is a mantra that you have to remember. Let's talk a bit about urinary incontinence. Okay, so urinary incontinence, I'm not sure how clear you are able to see this picture. Okay, this is the bladder, okay, over here. Can you guys see it? Okay, the bladder here. This is the bladder. This is the uterus, which is curving right on top of it. Okay, and this is the rectum where our bowel is ending. Okay, so sometimes this part, the muscles we call as the trigone area. So the trigone area is like what we call is like a iron, you know, it's like holding that whole place up, like an umbrella, you know, which is upside down. It's holding all these organs down. So we were talking about how the collagen is losing in the vagina. So similar things also happen in the muscle sheets surrounding this muscle basket, which is holding up. So when that starts to become loose because you have lost collagen, your muscles have stretched during childbirth or sometimes during frequent intercourse, or when you age, you have gone towards menopause, you pass menopause stage, you have no hormones, then the whole thing starts to shrink, like your uterus shrinks, all the surrounding areas start to shrink because uterus needs the estrogen and progesterone to maintain the size, right? So it shrinks. So when that shrinks, you find that everything is drooping down. So there is no support for the bladder here. There is no support because the muscles are all thinned out here. Then the bladder starts to descend a bit, and then when you go hachum suddenly or you cough, we call this stress incontinence, is the most common thing that happens after childbirth. And then of course around menopause and postmenopause is also a very common complication. So a lot of women in their older age, if they don't correct it now, they will end up having to wear diapers in their older age because it will get thinner and weaker and weaker. So of course, after if you just had a child, or you are very overweight and you have a big tummy here, which is also pushing down on the organs and causing urinary incontinence in some cases. Of course, you need to do whatever is necessary to lose your weight, but other than that, you should practice the Kegels. Okay, how many of you have heard of Kegels? I think you may have heard of it, but let me just teach you quick tips how to do it. You just need to clench your lower part, like you want to go to pass urine, but then you want to stop it, because no toilet available, something like that. So you're clenching it tight, shut. Something like this, you do clench as long as you can, relax. Again, clench as long as you can, relax. Start slow for those of you who have never done it before. Start with 10, for example, and then as you get stronger, you gradually can improve it. But for those who already have severe urinary incontinence, because you need a lot of Kegels to be able to get the full result of the tightening. So then we also offer some solution as in functional magnetic stimulation, where you just need to sit on the chair, okay, and then at the back portion of the chair, armchair, where you're leaning back, and at the bottom where you're sitting down, there is magnetic stimulation effect coming out from the chair, and you will feel it when you sit there. You will feel the contraction of the muscle fibers. You may ask, okay, the bottom is the perineum, where our bladder, our vagina areas are. So about why the back? Because there's another condition called urge incontinence, and urge incontinence is due to weak nerves. So sometimes the nerves coming from the back, from the spine, lower end of the spine, they get weaker due to so many reasons. Okay, then if they are weak, you can also have incontinence. Or sometimes we have mixed incontinence, where you have stress incontinence, is when you hatchum or cough suddenly without control, some urine dribbles. And urge incontinence, where suddenly for no reason you want to go to toilet and you cannot control. If you rush to the toilet, it's not like a lot of urine will come out, just a little bit will come out. And then after some time it happens again. This is urge incontinence, and sometimes there can be mixed types, right? So we have different methods of treating for different conditions. And then of course we also have, together with this, for people after prostate surgery, guys with erection problems, erectile dysfunction, we also have certain treatments we can do using this chair. So this is a very important addition, and a lot of times for very loose vagina and lower perineum, then I would advise the patients to do one of these treatments according to what they need, and after that they would do some sessions on this to tighten the muscle part. Okay, and then of course as a maintenance, you can always continue. Once your problem is cleared, you can always continue with your Kegels. But when you approach any of these issues, one of the first things you should do is, this is not something you call over the phone and say, how much is this treatment? Can I come for this? This is something very specialized, right? So whoever needs this kind of treatment should go forward, see the doctor, let us or let me do the vaginal examination and help you to choose. Or sometimes you may not need a treatment, you may just need some advice from me. I also do firming rejuvenation serums that you can buy back and use. It's my own production, and my production, everyone who knows my skincare and haircare products know that they all peptide and nanotechnology, so they work amazingly well. If you have a very borderline condition, you may just use the creams also. Can be used internally and can also be used externally to reduce and lighten the areas and remove some of the wrinkles and unwanted discolorations and so on. So if you are interested, please feel free to call us at this number, and I shall be there, especially because this is very specialized condition. If you come in, no one else is going to do consultation on you. I will be there to do the vaginal examination and do the consultation and advise you. That is a promise from me. Okay, now I'm going to go through the questions that has come from the audience. Oh, One of it is, I've read your article in the Malay Mail regarding designer vagina. Is it recommended for me to get a vaginoplasty as soon after giving birth to 2 children? Of course, if you already have finished giving birth to children, you're not going to have another child anytime soon. Of course, never say never, right? But not immediately. Then you can always consider. But designer vaginoplasty is a very cosmetic procedure. So basically, we are designing. So it doesn't mean only women who have given birth to children do it. A lot of younger people come to me as well, married or people with sexual partners. Sometimes they are shy about their labia majora being too loose and hanging, or it's too fat for some people. Sometimes the smaller lips, the vagina, the perineal area is akin to a flower, say a rose flower. So the outer lip is slightly bigger and the inner lip is inside that. So sometimes for some people the inner lip is longer and protruding out. So this will cause a lot of people to feel very shy, and then there can be functional problems from this. Some young girls and women do tell me that they have difficulty when they wear tight pants, tight shorts, or when they wear jeans, because this is protruding, so it's getting caught or it's getting rubbed and irritated all the time. So there's also functional, and there's a lot of cosmetic problems here because it just looks very abnormal. Likewise the clitoris, sometimes we repair the clitoris to make the sexual intensity better, but sometimes it can also be anatomically different from the general norm. This will cause a lot of lack of self-esteem, self-confidence, shyness, reticence, hiding away from sex or sexual partner kind of things. So of course it's not wrong to repair these things if you feel that you have one of these problems. And the other thing I would like to say is, a lot of women do suffer after a couple of childbirth or even after one childbirth due to hormonal changes. They do suffer from a lot of darkening and discolorations in this area. So this is a very common problem that we consult for, and I have a ready package which involves a combination of a very specialized laser as well as professional application treatments as well. Very, very effective. Yeah. So if you feel you have to do it at this time, yeah, you should do it. But maybe wait till your confinement is finished, and then we can do a consultation on that. Okay. Wow. This was last week's FB Live. Apparently, one of my fans said, "Hi doctor, how are you so beautiful and your face keep glowing?" Okay. Well, this is a long story, yeah. I think you need to be beautiful on the inside to shine on the outside. You see, you always have to, despite nobody's life is easy. I'm sure yours is not, and mine is not too. Okay, we all have our problems, maybe different problems, but there's nobody without problems. We all have our problems. But at the end of the day, we have to keep our mind positive. We need to stay happy inside. Every day we wake up, I think I put out a saying which came to me, is every day we need to wake up and not start thinking of our problem. We need to think of how beautiful life is. God has given me another day to do my best, with my family, with my friends. For me, it's with my patients, and how I can make everybody around me as good as possible as well. So when we start to work ourselves up to feel happy every day, that happiness will show on the outside also. Of course, other than that, definitely we need discipline in life. We need to use the proper skincare. I think we've spoken a lot about skincare. So I'm not using anything other than what I prescribe in my clinics. Nothing is hidden from any of my patients. Okay, if at all anything, I'm the slightly lazy type, but we still need to cleanse our face properly. We need to spend the time to apply our skincare regularly. And if we see I'm 60 years old and I didn't get perfect skin, or the best skin I have, is because when I saw some problems, I've treated it. When I saw that there was some pigmentation, I did not tell myself I'll wait till it becomes completely ugly, then only I start treating it. When I see it, even before other people can see it, I start to treat it. This is important. And then having a healthy diet. I like to eat different things, eating like a rainbow, different color things, not overeating one thing, not too much of carbohydrate, not only protein. Now there is a lot of fat diets out there. Okay, I only eat protein. I do paleo diet, I do keto diet, I do intermittent diet. All this, okay, you can do it for a while, but it's not something you can do in the long run. So to be good, as you grow older and coming to my kind of age, 60 and above, you need to have a moderate, kind of discipline in your eating habits as well. Once a while, yes, we all piggy out, and I piggy out too, but then on a regular basis, what we do every day is important than what we do once a while, right? So have regular, moderate, balanced food, and then exercise regularly. The blood circulation is important to keep the skin healthy and bright. Okay, so that is, I hope I have answered the question, and I hope that I have helped you to achieve skin that will be a lot better than yours, because I'm sure you're younger. If you start now, you can achieve better than mine skin. Okay, how does the vagina change during menopause? Like what we talked about just now, the vagina becomes drier, sometimes gets severe dryness and itchiness, peeling or plaque, whitish things in the area, things like that. Of course, the most common thing is it becomes very dry, not easy to lubricate even during sexual intercourse. Vaginal infections are common. There's shortening of the vagina because the collagen is gone, and the vagina does not stretch during sexual intercourse. So then it also has a lot of painful sexual encounters for many postmenopausal women. And the last question is, what is the difference between urinary infection and yeast infection? Yeast infection generally happens in the vaginal area, cervical area, outside in the labia areas, and urinary infection is pain when you pass urine, and infection in the urine, sometimes blood in the urine, that kind of thing. So it's two different things. But most importantly, what I've omitted to say, the first signs of that you got any problem with your cervix, leading on to cervical cancers and so on, is irregular bleeding. Okay, this is something you all should watch out for. So if you have sudden bleeding after sexual intercourse, or in between your period for no reason you are having some bleeding, then please go check with the gynecologist. Okay, I think I've taken a lot of your time. Thank you so much for being with me, and I hope to see you again next week, or even earlier if I have time. Until then, bye bye and take care, stay safe.